افتتح جلسة الكاردياك ايميجينج بالسي تي، وشرفنا نبدأ بأول اسم الأستاذ الدكتور رجب هاني، كلينيكال ابلكيشن اوف فوتون كوانتنج سي تي ان كارديوفاسكولار ايميجينج. اتفضل يا فندم.
بسم الله الرحمن الرحيم. مساء الخير. بداية يسعدني طبعا دعوة الأستاذ الدكتور إبراهيم حلمي إن أنا أشارك معاكم كسبيكر في الجلسة دي، وبنشكر برضو الدكتور محمد فوزي على تنظيم المؤتمر بكل فروعه. النهاردة هنبتدي جلسة الكاردياك سي تي. طبعا كلكم عارفين ان السي تي سكان يعني invented in 1971, وafter this invention CT يعني developed three innovations. First innovation was in 1980 by the discovery of spiral CT with rapid image acquisition. Then on 2000 the innovation of multi-detector CT scan, which started by dual 16, 32, 64, till we reached now to more than 1,000 multi-detector CT scan. After that, the development or the advancement in cardiac CT was usually most of the time was software regarding image rapid imaging acquisition, increased temporal resolution, increased spatial resolution. Then we have now in the third innovation of the CT scan, which is the photon counting CT scan. In my lecture, I will speak about the principle of photon counting CT scan. Then I will speak about the clinical application in cardiac imaging and in vascular imaging. You know the design of the X-ray detector or the conventional X-ray detector, which is called energy integrated detectors. As you can see here, the X-ray beam, okay, hits the scintillator, which convert the X-ray beam into light. Then the photodiode, okay, receive the light photons and convert it to electric signal. This electric signal will be processed to produce the CT image all of us know. So we have three steps. First, the X-ray production, followed by production of light by the oscillator. Then this light will be transferred back to electrical signal, which produce the image. The photon which hits the oscillator will collect it together or added up or integrated to create the signal that form the image. This image has no specific information. It is collectively about the tissues in that which proceed in that image. And also in the CT detector, there would be safety, which is present here, as you can see, between the detector elements to absorb the scatter photons so to decrease the noise of the image. In photon counting CT scan, instead of the three steps for production of the image, we have only two steps. The X-ray beam just hit the detectors, then it will be transferred directly into to electric signal, which converted to image. So now we have two steps in production of the CT image. Also, there is no septa in the detectors because there is no scattered photon. There is no light photon scatter, so no need for septa between the detector elements, and this help in the producing or production of thin detectors with a small pixel size. Photon count CT scan is considered the most recent innovation on CT scan technology. It is approved by the FDA in 2021. Okay, and now there is two photon count CT scan systems are available. This regarding Siemens started first, and now other countries will be continue. I think Philips had the machine, and this is under trial. GE and Canon, they are also under experimental trials. What are the properties of the photon counting CT scan? Here we have direct conversion on X-ray photon from X-ray to image or to signal to image. So this will be help in increase iodine signal. Also, this will be help in the production of what is called multi-energy information, which can help in some tissue characterization. So we can make virtual non-contrast, virtual non-calcium, and iodine maps. Also, there is no scepter in the detector, so we have a small pixel size, and this will be improve the spatial resolution. Also, absence of this scepter in the detectors will help in reduction of the amount of radiation, because we don't need excess radiation to produce the image, because there is no scatter radiation and there is no loss of energy. And this will be eliminate the signal noise and electronic noise. After that, the shaping of the X-ray with filters, energy thresholds, and tube potential will reduce the metal and blooming artifact, as we will discuss later on. Regarding the clinical application of photon counting CT scan in cardiac imaging, first application in calcium scoring. You know, calcium scoring is very important predictor marker for future cardiovascular events. The conventional or the true non-contrast scans for calcium scoring, this is expose the patient to excess radiation. So we have this will be added to the radiation produced by the coronary CT scan, and the total radiation will be more. Also, during this true non-contrast image, the calcium blooming artifacts will increase the size of the calcium, so there is overestimation of the calcium. Regarding the partial non-contrast calcium scoring by the photon count CT scan, okay, we make CT scan coronary, and after we made the CT scan coronary, we can produce what is called iodine image or iodine map, which enhance the presence of contrast. Also, we can produce what is called the virtual non-contrast calcium scoring. This will be give us a reduction in the total radiation, because now we don't have a separate scan for calcium scoring, and we expose the patient to radiation. So this will be reduce the total radiation dose. Also, this will decrease the amount, the total time of examination. This is a conventional image, okay? And by applying software to detect the low energy, intermediate, and the high energy, we can get two image. One of them which enhance the amount of contrast, which is called iodine only image or iodine map, and the other one without contrast, which is called virtual non-contrast image. From this image, we can calculate the calcium and score the patient. This is an example to compare and to enhance this situation. This is true non-contrast by conventional CT scan, and this one is by photon image. We have the contrast enhanced or the iodine map, and this is we have the virtual non-contrast. You can see that it is more or less typical like the true non-contrast. So we can reduce the amount of radiation to the patient and also decrease the time of examination. Regarding coronary CT scan, we have many advantages on a photon count CT scan. First one, we have improved contrast, we have improved spatial resolution, and also reduction of the noise. And this will allow us to see the small vessels and also to detect small calcification and non-calcified plaques characterization compared to the energy integrated detector CT scan. We have no calcium blooming artifact because the pixel size is small, and also there is no photon noise. Also, we have, if we have a small calcified plaque, we can characterize this and separate it into the calcified part and non-calcified part. This is also two images to show you the difference between the conventional dual energy CT scan and photon counting CT scan. You can see how the small vessels are delineated easily and can be folded. And if we make the curved multiplanar reconstruction, we can see and we can trace the small vessels and its branches. These small branches of diagonal we cannot trace usually by the conventional CT scan. Regarding also plaque characterization, okay, as we said before, we don't have the calcium blooming artifact. So if you have mixed plaque, we can calculate exactly the calcium part, and you can calculate also the soft or non-calcified part. And this also will help us in determining the vulnerable plaques. This is an example also for comparison to see how is the non-calcified plaque can appear in photon counting compared to the dual energy CT scan, and how the calcium blooming. You can see here the size of the calcium plaque is more encroaching on the lumen of the artery, yet its actual size is more or less smaller than the other one. This in cross section, it can help very clearly. This is also comparison between the same site of mixed plaque. You can see here the calcified part, and this is the non-calcified part, and you can see here how it is more easily to determine the size of the calcified part with no blooming for the contrast filled lumen or the calcified plaque. Stent imaging, very important character of the photon imaging, because you know that to make stent imaging, we have size of the stent, which can be more than 3 millimeters, so we can image this by CT scan. In small stents, we cannot, because the spatial resolution of conventional CT scan is very low, so we cannot estimate in stent patency or in stent thrombosis, or even the calcified wall outside the stent. This is a very nice example of magnified view of a stent. You can see the size, the thickness of the stent, also the calcification which is located outside the stent. Here you can see the blooming artifact because of the metal of the stent, metal component of the stent, which encroaches on the lumen and on the wall. Late iodine enhancement, this is also another innovation which can be seen by the photon counting CT scan, because here we have high resolution, and you can use low energy kilovolts, so you can enhance the amount of contrast. Here we have conventional late iodine enhancement CT scan in this patient. After 5 minutes of injection, you can see it is hardly to see the enhancement of the myocardium in this scar, but by the use of the low energy photon counting, we can detect the enhancement, and we can estimate the size and extension of the late iodine enhancement. Even now, there are some researches said that late iodine enhancement in a scar by photon counting CT scan equal or equivalent to the late gadolinium enhancement in cardiac MRI. You can see here, this is CT scan, and this is the cardiac MRI. There is more or less typical size and typical shape of the scar, and the extension of the scar between the CT scan and the MRI. Also, we have an advantage here of the use of a small amount of contrast. because we have the high resolution, we can use a small amount of contrast. It reaches up to 30% of the normal dose. And because of the low iodine, high iodine contrast, which is used in conventional CT scan, may obscure small calcified plaques. So we cannot detect this by CT scan. Also, you know the risk of high amount of contrast regarding the allergic reaction, also the impairment of the renal function. So this will be reduced by the use of the small amount of contrast. Also, the use of flow control is very important for the environment, as also the cost, because now you know, all of you know that the price of the contrast now is very expensive. Regarding vascular imaging, also there is many application of photon count CT scan in vascular imaging. In pulmonary arteries, here you can see how we can delineate the size and the shape of the embolus in the pulmonary artery, and also we don't have what is called the pulsation artifacts, which is produced in during conventional CT scan because from the superior vena cava, which is present in the superior vena cava. Aorta also, by low amount of contrast, may reach up to 50 or 50 milli of contrast. We can easily detect the whole aorta and stent in size. Also very important in the vascular, peripheral vascular imaging. Also, you can here compare between the conventional CT scan and photon counting CT scan. The amount of here is 55 milli. Here the amount is triple the amount of contrast. Even the blooming artifacts can be also here less in the photon count CT scan. Here we can see the calcified wall appears thicker, and also so it obscures the lumen of the vessels. So we have many advantages of photon counting CT scan. It gives us high signal to noise ratio, high spatial resolution, superior virtual non-contrast imaging. Also, we have the spectral imaging data, which give us different tissues like iodine, like calcium, or non-calcium. Also, we can reduce the radiation exposure to the patient and reduce the amount of contrast. And also, we can reduce the amount of or the CT artifacts. Yet, photon count CT scan also has limitation. Everything has advantage and disadvantage and limitation. First and very important limitation of photon count CT scan is the price. It has a higher cost, so and this also will make its availability. It is not available. Yani, even here in Egypt, there is no. I think there is no scanner for photon counting. Maybe in the future will be, but till now we don't have any CT scanner with photon counting. Also, the data management, it gives us many data, this data managing, so it needs large storage area and big processing powers. Technical complexity, because it is a complex algorithm, so it needs some training for the radiologist and for the technician. Also, the clinical experience and the long follow-up, because this, as you know, that it is about, it is used in the clinical practice for about 3 years. So the clinical follow-up and clinical experience in different imaging scenarios or in different clinical scenarios is not available until now. However, photon count CT scan is a promising technique to overcome the shortcoming of energy integrated detectors by combining multiple technical advancing, improving of spatial resolution, reduction of the electronic noise, beam hardening, iodine dose, and radiation dose. The use of photon counting CT scan in the future will lead to improved image quality and performance for many diagnostic tasks in the field of cardiovascular imaging. And thank you.